our call. So let me begin by welcoming all of you to our first session, group mentoring session for the spring. I cannot believe it, of 2024. My name is Beth Butler Fatal. I am Executive Director at Disability in North Carolina. We are a private nonprofit here in North Carolina, supporting employers across the state that are all focused on how they can transform their cultures to increase the representation of people with disabilities in their workplace. So we are excited to be with you today. Let me go ahead, and I apologize, I don't have my camera on. So let me turn that on. And again, just excited to be back with you again to launch this spring session of our group mentoring programs. These sessions are recorded, so that tends to help our students as well as our faculty members from the HBCUs across North Carolina that are really committed to this work, but have challenging schedules like a lot of us. And so we find it really beneficial to record these sessions so that those individuals can log in and enjoy the content of these offerings and these sessions at their convenience. So that is what we're doing. So with that, again, I'm excited. I want to welcome you to today's session. As an overview of disability in North Carolina and this program, I always kind of lead in with the idea of why this program, why Communability DINC mentoring. And I think it's important that we remember the purpose behind this, because we have so many, whether it's faculty or staff from HBCUs across North Carolina, or it's students, or even our business partners join these calls, and sometimes for the first time. And so what's really important, I think, for us to understand is that the purpose behind this program is really the idea that students with disabilities on college campuses across North Carolina are really at a somewhat of a disadvantage. We know that in the area of disability and employment, the employment rate among people with disabilities continues to be way lower, right, than those without disabilities. But when we look specifically at college campuses and we look at college graduates 1 year out from graduation that have achieved the same degree that their peers without disabilities have achieved, their employment rates are staggeringly different. Based on research, there's about a 28% employment rate among college students with disabilities 1 year out from graduation versus their peers that enjoy about a 75.5% employment rate. And so when we learned of that, that really was something that we had to lean into. And those barriers that we talk about all the time in this work exist, but for whatever reason, even when you achieve that college degree, those employment opportunities don't come, right? So this mentoring program is designed to help kind of bridge that gap. And what we believe is that as we open up conversations like the one we're having today, creating opportunities for you to connect with business professionals, business mentors, colleagues across the state that are interested in this topic, you can build that network of supports and connections even while you're still in school, right? Even while you're still getting your education, to help broaden your scope of networks and opportunities as you transition from your college experience into your careers. So that's the purpose of why we're doing what we do. Let me say this as well. I am a person with a disability. I have a non-visible disability. I have been where, if you are a student on today's call, I've been where you are. I have been on a college campus trying to navigate having low vision or legal blindness, and kind of what that feels like, communicating with professors, again, just trying to manage the academic side, right, of a degree, while at the same time trying to stay connected with activities and programs and things that I know are of value, right? And as you build that network and look for internship or apprenticeship or employment, summer employment opportunities, all of those things are really, really important. So again, I'm excited to have you here. And at this point, I do want to invite anyone that would like to open conversation in the chat. So I'm going to encourage anyone that wants to engage with one another using the chat opportunity through the Zoom platform. But also want to pause and invite anyone who would like to introduce themselves during today's call, and simply state your name and your the organization that you represent.
Hi everyone, my name is Leanne Turigny. I'm currently working at UNC Charlotte, and I'm also a student here getting my master's in psychology.
Good afternoon. I'm Deborah Pickens. I'm Billy's mom. He didn't take himself off of mute, so I'm gonna introduce the two of us. But we both graduated from UNC Charlotte, and Billy is totally blind with progressive hearing loss. And we have worked with Exceptional Children Assistance Center. He's still doing some podcasts, but he graduated from UNC Charlotte with a degree in communications and journalism.
Good afternoon. I'm Ann McIntosh, and I am a college professor. For about 23 years, I taught at Central Piedmont Community College. I currently teach at University of Maryland Global Campus and also at Gallaudet University in Washington, D.C. And I own a company that is certified by Disability In. It's called Safe and Clear. And what we have, I think I've got one right here. It's clear mask, surgical mask that you would use at a doctor's office or for surgery or going to a dentist. And what this does is it provides inclusivity and makes communication accessible for people who are deaf, hard of hearing, deaf, blind, on the autism spectrum, or are just visual communicators in general. So I am just listening in to see how it is that I can be of support to others, and also to just help to advocate for clear communication for whatever a person's needs may be, because we think that communication is a basic right that should be accessible to everybody.
Great. Thank you, Anne. I appreciate that. Appreciate you joining us today. All right. Well, in the interest of time, and again, I just encourage you to use the chat and engage in conversation. I'm also going to ask Leanne if you would just to watch the chat feature as well, just in the event that there are any comments or questions that would be shareable for the good of the group. As we move into, and I'm excited to present our featured speaker for today, but I also want to just remind you our group mentoring sessions will continue. We've got 2 more after today's session. Our next one will happen on March 20th. I'm still in the process of firming up our speaker, but I'm hopeful that we will have a speaker with us that will focus on the issue of financial education. And so really excited about bringing that topic to this group as well. And then our final session will happen on April 24th. And that will be a message and a presentation from Mr. Roy Dockery, who is an author. He's done a lot of things. He's an author. He is a content creator. He's an entrepreneur, and you're going to really enjoy his conversation that will focus on leadership. And so leadership and entrepreneurship. So excited to bring those sessions to you. But I'm very excited today to introduce our speaker. And what I love is where I learned of Dr. Price. So St. Augustine's University hosted a staff development day in early January and invited me to present during that session and share with them kind of the focus of the communicability mentoring program, but more importantly, the role as staff members, right, in their promoting disability inclusion and communicability on their campuses. So in doing that, was invited to stay for the remainder of the presentations, and Dr. Price happened to be the next speaker, and really loved her message. So you're in for a treat. Dr. Price is a Wake County native. She received her medical degree and completed a child and adolescent psychiatry fellowship at the University of North Carolina at Chapel Hill School of Medicine. She is a board certified in general psychiatry. Having devoted her career to improving the health and mental wellness of those that have mental health issues and the marginalized in our society, Dr. Price has over 20 years of experience from her work with UNC School of Medicine, Daymark Recovery Services, Correctional Institute for Women with the North Carolina Department of Public Safety, Wake Med, and her private practice. So she really doesn't have anything to do, it doesn't sound like. At Wake Med, Dr. Price was the medical director for behavioral health community case management and Wake Med's homeless outreach team, or HEART. And the medical director of Wake Med Physician Practices Wellbeing Initiatives, where her mission is to improve provider well-being while promoting the culture of wellness, work-life integration, and joy in work. And most recently, Dr. Price became the behavioral health medical director for AmeriHealth Caritas of North Carolina. She is also a member of the Sister Circle, which is a group of African-American female physicians whose combined efforts have increased the vaccination rates in Black and Latinx communities in Southeast Raleigh. Dr. Price is passionate about helping others achieve her life's purpose by achieving and maintaining mental health wellness. And so with that, I am thrilled to introduce to you Dr. Nerissa Price. Dr. Price, I'm going to turn it over to you.
Thank you, Beth. I'm definitely gonna have to change my bio. It's a bit lengthy at this point. I hope you all will get basically the bottom line is that I'm very passionate about this work. I feel like this is our time in mental health to really share what successful mental wellness should look like. And so I just love the opportunity to talk to any groups about mental health. So let me share my screen. And here's another thing about me too, that I don't need to hear my my own voice the entire time. And so if we go along and you have questions or comments, please put them in the chat or raise your hand, and we will try to get to them as they come up. So I developed this talk some years ago, really just to try to give people a baseline for the discussion about what mental health is and what mental illness is, and just kind of go from there. But again, I really do want your participation. So please let me know what your thoughts are. So let's define what I mean by mental health. So mental health is a state of mental well-being, and this is the World Health Organization's definition, that enables people to cope with life stresses, realize their abilities, learn well, work well, and really contribute to their community. So when you look at that, like, to me, mental health is everything. It's so important. And it hasn't always been viewed that way. I think we have oftentimes had a really laser focus on physical health, but there really is so much related and intertwined between the physical health and mental health that's really important to recognize, that it's as important as physical health. Everybody has mental health, and on that continuum, perhaps it's, for some people, it may be better or healthier than others. Just like we have in physical health, some people are, let's say, Olympic athletes, with their physical health and wellness, and others may not be as lucky. The same continuum exists with mental health. And so what do I mean sometimes when I talk about mental health? Because when I really go under the surface, it's quite complicated, that there are a lot of contributing factors to what makes you feel mentally well. So for example, when I talk about mental wellness, I am certainly talking about emotional wellness. And most people kind of get that from the get-go, that we are talking about what your mood might be like from day to day, and how that affects your quality of life. But I'm also talking about your financial wellness, because think about that, like your financial wellness, like how satisfied you are with your current financial state. That has a huge amount of influence on how you feel mentally. If things are not going well, with your checkbook, do people use a checkbook anymore? But anyhow, your bank account, let's say that one, then it really may impact how you feel emotionally and mentally. Also, social wellness. And so this is, do you feel like you're able to connect with others? Do you feel a sense of belonging? If you don't, and we often talk about the loneliness epidemic and how it has serious implications on an individual, not just mentally, but also even physically. So having that social connection is a part of what makes you mentally well. Spiritual. And so I think in medicine, sometimes we're a little scared of this concept. And so we may not talk about it very much, but it's absolutely an important part of our mental wellness. And so what I mean by how I define it is that, do you have a sense of purpose or meaning in life? And do you feel like you're supposed to be here? And individuals who seem to have that connection or that spiritual well-being, it does contribute positively to their mental well-being. There's also occupational. So everyone wants, back to that purpose of issues, that most people want to have a purpose, and oftentimes our purpose is connected to what we do in the way of employment. And so, are you happy there? We spend most of our time at work oftentimes than we do with family or friends in the day. So if you're spending all that time, do you feel like it's a good fit? Is there joy even there? So it has a big impact on how our mental wellness overall is. And then, of course, physical, as we've mentioned, that, if you're, and these two kind of feed off of each other, in that if you are physically well, it may make you feel more mentally well. And the reverse is true as well, that if you're having more physical difficulties, it may affect your mental wellness. Also, we have intellectual wellness. And so most individuals recognize that they want to be more. They want to expand their knowledge, perhaps have certain creative outlets. And so having some of this also can help contribute to our sense of mental wellness. And then finally, even our environment. So where we actually live, where we work, where we play, those type of environments really do factor strongly in if we feel safe and if we feel mentally well. So when I talk about mental wellness, it's really a lot of everything. This is a quote that I'd like to read just for a moment, just based on Dr. Schwarbeck, and she says, wellness is a conscious, deliberate process that requires that a person become aware of and make choices for a more satisfying lifestyle. And I think this is also a very important issue, that if we're not really actively thinking about pursuing mental wellness, then we're probably not doing enough. All right, so we've been talking about a little bit what mental wellness is. So what do I mean by mental illness? So mental illness is a mental health problem that significantly affects how a person feels, how they think, how they behave, and how they interact with others. And it's very important that, we've come a long way with our understanding about mental illness, like really what the origins are, and it has very clearly become clear to us that mental illnesses are brain disorders. These are brain diseases. So this isn't just that someone, can snap out of it per se, but these are real conditions. And it's also important that the impact and the effect of mental illness, it really varies on the individual. So it can look quite different. So you can have two individuals, for example, with depression or major depressive disorder, and they may look differently. One may have difficulty showering, wear sweats, sit on the couch and snack on, junk food all day. The other may look, be dressed to the nines, may go to work every day, may be looked and regarded quite well by colleagues. And so it's very difficult sometimes to just look at an individual and actually know whether or not they have mental illness. And that's interesting, Beth, that you mentioned that as well about disability. And I think that's very true about mental illness too. It's also true that a lot of mental illness in mental illnesses are episodic. So it may be that someone, you may catch them during a time period in their life where they may not actually have symptoms that are obvious of a certain mental illness. And then there may be other times where those symptoms really come clear to the surface. So that's something also to take note on. Again, any questions or comments, please let me know. And whoever's monitoring the chat, I can't see anything, so please let me know. So this is a great picture. It's a functional MRI scan, and it shows and whether you're a radiologist or not in the group, I think you'll be able to see a huge difference between a depressed brain, which is on the left. You see all the blue and very little of the lit up areas, versus on the right, where you see someone who's not depressed. So you can tell already there's a huge difference. And really what the coloring, what it displays is the metabolism in the brain, glucose metabolism in the brain, and which roughly correlates to the activity of the brain. So here we see a person who is depressed has less brain activity than someone who is not depressed. And so you can really see how that could really impact someone with depression, like when they're a student, for example, that they, all cylinders may not be firing. They may not be at their very best in that way. And so, but this is real proof, real evidence that that mental illnesses really are brain diseases. So how common is mental illness? Incredibly common. So 1 in 5 adults and adolescents live with a mental health disorder. And I read an article recently released by Harvard, who said that within the world, it's likely that 1 in 2, so the numbers are increasing. At some point, someone will experience a mental health problem. Now, it may not be to the level of a disorder, but some sort of mental health problem. So incredibly common. 75% of mental disorders begin by the age of 24. So this is really important. And, my background is child psychiatry, and I find that, our efforts for treating mental illness really should begin further and further upstream to help to identify in the young, in children and adolescents, when these conditions may surface, because it really can make a difference if we catch them earlier. But the vast majority are going to show up in someone who is a young person. And typically when a mental illness begins, it can be associated with some sort of distress. So the individual might be distressed that they're somehow not focusing it or functioning in a way they did previously. It's also possible, by the way, that the individual may not have much insight on their mental health state. And so this is often common with certain mental illnesses, that parents or friends might say, "Hey, I'm worried about you." And then the individual is like, "I'm fine," and may not have that complete awareness. But typically, if someone has a mental health illness, there are usually some sort of problems in their functioning, either socially, maybe they're not, connecting with others, their friends or family like they used to. Maybe they're having more difficulty at work or in school. And then they also may withdraw, for example, from certain family activities. So there's usually some signs. Again, I mentioned this before, but it's important to mention again, mental illness isn't about willpower. It's not about, I talk to a lot of churches as well, it's not about spiritual weakness. These are brain disorders. And so it's not something you can snap out of. So here's the good news. The good news is mental illness is highly treatable. So we have come a long way in this regard. So if an individual has symptoms, that there's likely a treatment that we can offer them. So people sometimes will ask me, well, where does mental illness come from? And again, there's been a lot of work to understand this as well. So there's probably, it's complex, and there's a combination of multiple factors. So for example, genetics. So we know that mental illness often runs in families. Bipolar disorder, for example, is probably the most genetically related mental illness. And so, if, for example, in your family, if there's a history of mental illness or like, for example, depression or bipolar disorder or alcoholism, you have an increased risk of developing those conditions as well. But it's not just our genes. Also, there's the individual brain chemistry that we have to look at, like I mentioned, like showing you the image I showed earlier with the brain functioning. that really what that oftentimes relates to are the individual's neurotransmitters and how they may be functioning. And so for one person, they may have an abundance of some of those healthier receptors and neurotransmitters, and they, may not have mental illness because of that. Well, where someone else may have more of a predisposition for this. If there are environmental exposures before birth, so the time in development within the womb during pregnancy is a critical time, not only for making sure babies have all their fingers and toes, but also their brain development and what their brains are exposed to. And if they are exposed during pregnancy to certain environmental exposures, it could increase the risk. So for example, might be if they're exposed to alcohol, or if their mother was under an intense amount of stress. This might increase the risk of later developing mental illness. We talk about adverse childhood experiences as well, that we do recognize that there's a correlation if people during their childhood have had certain stressful events or traumatic events. So like, for example, if they had a parent figure who also had depression or a substance use condition, or if their parent was taken away from them and went to prison. So these are examples of adverse childhood experiences, which, by the way, are extremely common also in America. And so we know that if you have any of these, that it may increase your risk factor for developing mental illness later in life. Also certain physical health illnesses as well, have been correlated if you have these experiences when you're a child. Trauma, I mentioned that specifically. So trauma, we're learning more and more the effects of when bad things happen, that they tend to really trigger our internal fight or flight systems. And if this happens to you repeatedly, where you're experiencing trauma, or if this happens when you're very young, it can really kind of set you up for a predisposition for mental illness later. And also trauma, by the way, not only can it increase your risk of mental illness, but also physical illnesses have been connected. We're learning more about nutrition, even that the foods that we eat might actually play a part in later developing certain mental illnesses. We know, for example, that if an individual is deprived of vitamin D, so perhaps they're, it's nutritionally they don't have as much access to it, or if they find themselves staying inside and not getting vitamin G from the sun, that sort of thing, that actually can lend to not only low vitamin D, but also depression even. And that's an example of a reversible cause of depression, so that you would actually treat by just supplementing with vitamin D. There are also hormones. So we know that during times of development where there are huge shifts in hormones, like during pregnancy or postpartum, or even when a young girl begins her period, that they're really, those are vulnerable periods for developing mental illness. Stress is bad. It just is. And again, it goes back, like several of these are connected. Like I mentioned, trauma, stress, adverse child, all of these are connected. And there's probably an underlying physiological process that is contributing to why having these things in our life do make us more predisposed for mental illness. I'm not going to go into that as much now, but again, this is where a lot of the research is really helping us to understand, how does mental illness develop? Sleep is so important. We don't like to in our society. We need to cram in every little ounce of everything, but really sleep helps to build a healthy foundation to keep us mentally well. And so if we have more difficulties with sleep, it can actually predispose us for mental illness. And if we do have a mental illness, if we're not sleeping, it can really impact the severity of the mental illness as well. And then, of course, substances. And here I'm talking about illegal substances that people might abuse that can also cause problems with mental illness, but also that we use substances in a positive framework, such as medications, to really impact mental illnesses as well. So lots of different reasons why someone may develop mental illness. It's important if you suspect that if you have a mental health condition, go see your doctor, go see your primary care provider, your internist, whomever, to get a good physical and blood work, because there are a number of conditions that look like depression, but they actually are some physical illnesses. So like thyroid conditions I have here, or can look like depression or even panic attacks, anemia or vitamin deficiencies, like I mentioned, like the vitamin D deficiency, or certainly substance use disorders, or certain medications, certain side effects of medications can be mental health related concerns. So we want to go to the doctor. And then there's some neurologic and autoimmune conditions. So again, bottom line, sometimes the first step, if we are having those symptoms, is to go to the doctor to make sure that we don't have something physical health-wise that looks like it's mental health, but it's actually physical health. I see something up in the chat. Are we okay? Or is it something someone can tell me about? Her? All right, so there are a number of common mental health disorders and I've mentioned some of these names already. Major depressive disorder, we also just call it depression, anxiety disorders, bipolar disorder, post-traumatic stress disorder or PTSD, obsessive compulsive disorder, attention deficit hyperactivity disorder or ADHD, schizophrenia, autism spectrum disorder, and substance use disorders. And so these are just some of, but probably the most commonly known mental health disorders. And just for a moment, I'm going to go a little deeper on major depressive disorder. So depression or major depressive disorder is a common and serious medical illness. And so it's normal from day to day to feel sad, or even what we would say depressed. That's normal. Like we're talking about every human being has some sense of sadness at times. Or if we have significant loss, we may experience grief. Also very normal. But depression is different. It tends to be more constant. And so when you look at it, it's more days and most of the day that we are stuck in this feeling of sadness. It may or may not have a trigger. So some people think, why are you depressed? Life is going well. It doesn't have to have necessarily, although if there is a trigger like a loss or something like that, it certainly could lead to a depressive episode, but it doesn't have to. It is the worldwide leading cause of disability, which really breaks my heart when we talk about this being so treatable. And yet what happens is that there's so many people who are quietly suffering, I think, from depression, or maybe even they don't know that that's what's going on with them. But this is what may lead to them not being able to fulfill their true potential. And depression really can range from mild to severe. And so when we think about severe, we are talking about individuals, for example, who may have suicidal thoughts or who may have difficulty with reality or things like with hallucinations or delusions. But there really is a continuum, a range of severity. These are the symptoms of depression. And so there are 9 symptoms. You have to have 5 of these in order to qualify for depression. And these symptoms have to be present for at least 2 weeks continuously for you to be diagnosed with depression. So feeling sad or having a depressed mood, loss of interest or pleasure in activities once you used to enjoy. You may have some change in appetite where you may eat too much or eat too little. And again, this is not related to dieting, so this is just happening. You're having trouble sleeping, or maybe you're sleeping too much. That could be a symptom. Maybe you're feeling yourself just a low energy or fatigued. That could be a symptom of depression. Others might experience increase in a purposeless physical activity, so more restlessness. They're moving around, they're pacing, maybe they're wringing their hands, that sort of thing. Or the exact opposite, some individuals actually slow down by depression, and they literally are moving slower than they might normally. Many people might have this sense of worthlessness, like, I'm not worthy or to be here even, or maybe have excessive guilt, like thinking everything's their fault, even though maybe it's not even related to them at all, but that can be a symptom of depression. And then having some difficulty thinking, concentrating, or making decisions. I go back to the scan that I showed you all. If your brain really isn't firing, like, you're not as alert or maybe able to focus and problem solve like you might normally. And then finally, individuals sometimes with depression will have thoughts of death or suicide. And again, this is always an emergency. Even if someone says it in joking, I really want that person to get help as soon as possible, because oftentimes, there's some truth even behind jokes. And so depression can look a little different with children versus adults or elderly. With children, they may seem to be a little bit more clingy or irritable. You also might see them not performing as well or not wanting to go to school as much. Elderly people may have more memory difficulty. In fact, they may be thinking they have something like Alzheimer's when it actually might be untreated depression. They also might want to isolate more or stay at home. This is called a PHQ-9, a patient health questionnaire. If you look at it, sorry, I got allergies. If you look at it, so these are there are 9 questions that correlate with the 9 symptoms of depression. You might recognize this. More and more doctors' offices are doing screening for depression. And they're asking these type of questions to see, in fact, if you may have depression and maybe not know it. So I want us to talk a little bit about treatment, because again, it's highly treatable. And what's nice is there are lots of different treatments now. So we talk a lot about medications, which I mentioned that really mostly they focus on trying to improve the brain chemistry imbalance. There's also psychotherapy. This is, to me, kind of amazing, but the fact that talking to someone who's been trained can actually be an effective treatment for your depression. In fact, for mild to moderate can sometimes work just as well as medications. And the truth is, what we've seen a lot of times with certain mental illnesses, like, for example, depression, the combination of medications and psychotherapy really work the best. So if you have both going at the same time, is what's going to get you healthier quicker. We also have brain stimulation treatment. So this could be electroconvulsive therapy, or you may have heard of transmagnetic stimulation treatments. And so this is like the brave new world, very interesting treatments. I imagine one day some of these are going to be that you'll take a little piece of equipment home with you, and you'll do your own depression treatment one day. I think we're going to have that. There are also alternative complementary treatments. A lot of this is focused on nutrition, or exercise can be really helpful for depression, and a lot of people, or even certain herbs. And so, but whatever route that you decide to go with treatment, definitely talk to your doctor about it to make sure that you're not working against yourself, but really putting together a good treatment strategy. And then finally, there's hospital and residential treatment. There are some occasions when the illness is so severe that people do need to be in a certain safe safety, a setting that allows for them to be safe, and their medications and treatments closely monitored. I do want to just say quick words about mania and depression. So we've talked about depression, but if an individual has mania, which is where they go through periods where they have elevated energy, like out of nowhere. Oftentimes they maybe even feel hyper feelings, so they may even notice that. Oftentimes they may not sleep as well because they have this natural energy going, and sometimes they do things they wouldn't normally do, like maybe they speed or go to the store and buy a lot of things that they cannot afford. So if you ever have those symptoms, it's important to mention that to your doctor as well. A lot of people will go to the doctor and tell them about the depression, but they might forget to mention the other side of the spectrum, because if an individual has both of those symptoms, it may mean that they have bipolar disorder, and there's a different treatment strategy for bipolar disorder. Also, if an individual has psychotic symptoms, so this is what I mean by hallucinations, like hearing things or seeing things other people can't see or hear, or having thoughts, for example, like paranoid thoughts, like people are watching them, talking about them, that sort of thing. Then that also is something that's really important to mention. Oftentimes, if an individual has these symptoms, they get referred to someone like myself, a psychiatrist, who has more specialty in that. So that might happen. Like if you go to your general medicine doctor, they might refer you to someone like me if you have these type of symptoms. And then, as I mentioned before, suicidal ideations always should be taken seriously. It's always something that need to be followed up. And sometimes it's not always clear what people are saying. So sometimes people may actually say it like, I want to die, or if I've thought about wanting to hurt myself. So that's pretty clear. But sometimes we have to listen a little closer. If someone said something like, I wish I wasn't here, I'd be better off if I wasn't here. So maybe it's not necessarily super clear that an individual there may have some suicidal thinking, but this still needs to be evaluated by a professional who can really dig a bit deeper. So I would say in either case, if your spidey sense is going off about something like that, if someone is sounding more hopeless, I would say try to help them get help. Speaking of getting help for others, it's not always the easiest thing because a lot of people, there's still so much stigma in the world about mental health. It's much better than it used to be. And I would say in the younger populations, I'm really proud of them. They seem a lot more open about embracing and sharing if they're having mental health difficulties. I'm also really proud of the celebrities who come out and share their mental illness. But when you're helping someone who has a mental illness, here's a few tips to think about. First of all, have kind of an open, non-judgmental discussion about it. Like bring it up as like, you know what, I've just noticed that you don't seem yourself, or you seem sad all the time, and which is different than maybe before. Open, and then close the mouth and listen to what the individual may say. Be ready with your resources, which I'll touch base in a few minutes. Don't be surprised if you don't get thanked for bringing it up, that in fact you get a reaction of anger or even denial, because again, it's really difficult in our society that we still see depression as some sort of weakness in a way that we don't look at physical diseases, like if someone had cancer or diabetes or something. So don't be surprised, but also don't give up and keep on checking in on your person. It's important for me to note that there are mental health disparities, which is true for a lot of conditions, that even though African Americans, for example, have less mental health disorders, that when they finally do show up for help, they tend to have poor outcomes, poor functioning, more disability, and a longer course. And there really may be more barriers to treatment. And there are some particular alarming trends that occur with African Americans, which I'll talk about in a moment. There are barriers, for example, related to getting access to treatments, particularly African Americans tend to not have access to insurance, or they may live in neighborhoods where there's virtually no mental health services, or maybe there's an emergency department, but that's it. A lot of African American individuals would prefer to work with someone who's Black or brown, but unfortunately, there are not as many Black providers, though with social work, there tends to be a lot more available in that way. And then when African Americans go to treatment, if they make it, there have been research studies to show that they actually receive poor quality of care. And then oftentimes might be misdiagnosed with certain disorders like attention deficit, hyperactivity, or conduct disorders, when really there might be something more underlying, such as dealing with anxiety or depression. And also African Americans have often been misdiagnosed as having schizophrenia as opposed to having a mood disorder like bipolar disorder. So there are lots of reasons why, if you're dealing with Black or brown people, why they may have a lot of caution with coming to treatment. There are some alarming trends in the United States. Sadly, our suicide rates have increased, where compared to other developed nations, that number has actually gone down. And particularly in brown and Black children, there are trends. It is the second leading cause of death amongst Black children aged 10 to 14. And it is more common that Black boys will die by suicide than their white counterparts. So before I leave, though, I do like to tell people also about some of the resources. And Beth, I can send you a copy of this slide deck if you'd like to distribute to others. But 988, I hope you guys know about that. This is a 24/7 nationally launched number. You text it or you call it, and you get free confidential emotional support for someone who's in crisis or just having emotional distress. And so this is a wonderful resource that was only launched a few years ago. They will try to connect you to local resources. I think some of the folks on the call were students. So if people are thinking, hey, some of this may sound like me, I'd like to get some help. Student health typically is a great place to start. If there's emergency care, you can always call 911 or go to your nearest emergency department. If you call 911, ask for a CIT officer. This is crisis intervention trained, and these are officers who's particularly gotten training with mental health. And so if you have health insurance, it's a great place to start. The website, for example, of your insurance provider to show potential folks that are within the network. Or you might go to your primary care doctor and then they can connect you to someone. Because I thought some of the members here were from Bennett College and in Greensboro, I included that Guilford County also had some really good resources for the mental health. And then to offer to you all here today on the call, we have been given subscriptions from Wake Med Hospital, which is in Raleigh, to distribute to members in the community, the Calm app. And so the Calm app, you probably have heard about it, can help with sleep, meditation. It's been shown to improve sleep quality and focus and reduce stress, anxiety. And so if you are interested in a free subscription, again, Beth, I'll send this out. Then what you need to do is if you click the link, and I can actually, let me get out of here and put this into the chat for us. Let's stop sharing. And put that there. If you, oops. All right, here we go. I guess I could have had that ready, huh?
That's all right. You're doing
Here's
great.
the link. Here's the link. If you click it, it does ask you to answer 3 questions. And then within 1 week, you'll receive an email from hello@breathe.calm.com with instructions on how to activate the app. And the app is free. This is like a $50 subscription if you had to pay for it on your own. But it will be active until November of this year. So that is all I have for today.
Well, I am so grateful. I knew the amount of information you cover in such a short time is phenomenal. So thank you. Thank you for joining us. Thank you for the work that that you are doing to just bring awareness and focus. Particularly again, you know, as we move through this work together across North Carolina, and specifically with the students with disabilities on HBCU campuses, this is a topic that is really, really important. And so again, thank you for the work that you are doing and your commitment to this space. I know in the interest of time, I've got about 2 minutes left on my clock. So with that, we want to thank you guys for joining. Leanne, are there any burning questions that you see out there? If not, I would invite you reach out to us with any questions you might have, and we're happy to pass those along to Dr. Price. Also want to encourage those that are on the call today, if you have an interest in becoming a mentor to one of our college students on one of these campuses that is looking for a connection to a business mentor, please let us know. You can complete an application by going to our website at di-nc.org. And clicking on the mentor application. We also invite those students that are on today's call, if you have an interest in being mentored one-on-one and matched with a business mentor, complete that mentee application that's also available out on our website. With that, if there are not any questions or comments, I'm going to thank you all so much for joining us today, and look forward to our next session together. So thank you so much.
Thank you.